Today we are going to test the Evita V600 in CPAP mode and ATC mode. We connect the ventilator through a 7mm endotracheal tube and a artificial trachea to a lung simulator, and we are also going to test the full ATC tube compensation for a 7mm tube. We are observing the flow and pressure traces on the lung simulator, and for that we use the screenshot. So the orange line is the airway pressure and the blue line is the tracheal pressure. Now the ventilator is in CPAP mode and we expect the airway pressure to follow a straight line here indicated by this orange dotted line. It is not quite exactly on this dotted line, so there is some deviation which we quantify by this RMS, the root mean square or standard deviation of the airway pressure normalized by the standard deviation of the airflow. And what this essentially is a resistance, an effective resistance of 1.4 millibar per liter in second. So not bad. But now we are switching to ATC mode and we want this tracheal pressure, the blue line, to be constant at 5 millibar. But we notice is, well, during inspiration the tracheal pressure is lower, during expiration it's much higher, and the root mean square tracheal pressure, that is the resistance, the effective resistance, only decreased from 7 to 5.4 millibar per liter in second. So that's not enough, that's not good. And one more thing, you notice that the airway pressure needs about 300 to 400 milliseconds to rise above the PEEP level during inspiration and fall below the PEEP level during expiration. So just for comparison, let's do a real extubation, and when we do that, the first thing we notice is that the added resistance goes to 0. And second, that the expiratory flow increases dramatically from 0.7 to 2 liters per second. So in summary, the Dräger Evita V600 compensates only about 25% of the tube resistance, and that's probably not enough to make a clinical difference.